started.
Mm-hmm.
My name's Mark Wall. I'll be conducting a complete history on my patient, Daniel Powers. I'm a Valdosta State nurse practitioner student, and we'll get started here. Daniel, what have you come into the clinic for today?
Having a little bit of a headache. Started last night, just kind of a mild headache, and it was worse this morning.
Okay, so it started last night, and where in your head? Is it more in the front of your head? Like where on your head?
It's kind of like back here, kind of the occipital region.
Mm-hmm.
Kind of just a dull headache.
And has this ever happened to you before?
Yeah, I mean, usually it's like if I'm like spray painting something and I'm not wearing like a respirator or mask or something like that.
How long would you say this has been going on?
Really just started late last night, probably 10 o'clock at night.
Mm-hmm.
And it's a little worse this morning.
Is it like a dull pain, a burning pain?
Yeah, it's like a dull, kind of aching pain.
Okay. Is there anything that you do? I know you said you spray paint, but is there anything else you could do that could aggravate it that leads this headache on to start?
Not that I can think of.
What about anything that relieves it? Anything?
I took some Tylenol. It provided a little bit of relief, but
you don't do anything like putting a cold rag on your head or anything like that?
I haven't tried that yet.
Okay. I know you said you take Tylenol. Is there anything else that you've taken that helps to relieve the pain?
Sometimes I'll take a Motrin or something like that for a headache, but I haven't taken any for this one.
Okay, so on a scale of 1 to 10, how would you rate this head pain?
Right now, it's about a 4.
Okay. What kind of childhood history do you have? Did you have any medical problems growing up?
Not anything real serious. I had a UTI when I was a baby.
Okay. Any adult medical problems? Any surgeries? Any psychiatric issues?
Do
you have high blood pressure? Are you diabetic, or do you have bronchitis?
No. I had just some oral surgery from some tooth trauma, but no other significant medical history from my adult years.
All right.
No hospitalizations.
Do you have any? Have you up to date on all your immunizations?
Yes. Yeah, I had to get immunized for the program that I'm in at Valdosta State. I'm also in the psychiatric mental health nurse practitioner track, so I had to get updated on everything. I'm up to date on my flu vaccine for work for the current season.
Okay. Are you allergic to anything?
I'm allergic to pelagic fish. For all y'all out there that don't know, that's open ocean water.
Okay. Do you smoke?
I do not smoke.
Do you do any street drugs?
I do not.
Do you drink alcohol?
On occasion, yes.
Okay. How much is on occasion?
Probably 3 to 5 drinks, maybe once a week.
Okay. All right. Do you what's your diet like?
I eat pretty healthy.
Do you exercise daily?
I don't exercise every day. Whether I'm tired from working 12-hour shifts, I may not work out that day, but I work out probably 2 to 4 times a week.
Okay. Do you get any routine history and physical every year?
I do for work, yeah.
Okay. What kind of family history do you have? Like what kind of medical problems run in your family?
Hypertension. My mom and my dad both were diagnosed with hypertension. Me, I've been borderline, but I kind of manage that with exercise and diet.
Okay.
I checked my blood pressure yesterday. I didn't check it yet today, but it was like 114/80. So.
Okay. Well, is anybody like any of your parents deceased?
My father, he passed in 2010.
What did he die from?
Cerebral hemorrhage. He had a hemorrhagic stroke.
Okay.
Again, that was actually probably due to rebound hypertension. He was on antihypertensives and he didn't fill his prescription.
Okay.
So that's probably what happened with him. But I haven't looked into his medical records. I don't want to look at them.
Okay. All right. So basically, hypertension, cerebral hemorrhage run in your family. How old is your? Any health problems with your mom? I know she's still living.
She takes her medications like every day on time.
What kind of health problems does she have?
She has hypertension as a medical health problem, and then she's also got a psychiatric history. She's had depression,
Okay.
that kind of thing.
All right. Any living grandparents are still alive, or what?
I have no living grandparents.
Okay. What did they die from?
Natural causes.
Okay.
Old age.
Okay.
They were all in their 80s and 90s.
Okay. All right. What do you do for a living?
I'm an RN.
Okay. Were you in the military?
No.
Okay. What's your highest level of education?
I'm currently pursuing a master's degree.
Okay. What do you like to do for leisure activities?
I like to fish. I like to hike. I like to go camping, road tripping.
Do you exercise regularly?
Probably 2 to 4 times a week or so.
Okay. Any recent weight changes? Any decreased activities of daily living? You have trouble brushing your teeth, doing laundry, anything like that? Any weakness, fatigue, anything like that?
No. I don't have any problems brushing my teeth. No weakness or fatigue. I have experienced a little bit of weight loss lately, but that's intentional. I'm trying to reduce my portion size and caloric intake per day.
Okay. Any skin problems, rashes, lumps, lesions, moles?
Yeah, I've got quite a few moles. I've been to the dermatologist within the last 6 months. I did get one mole biopsied on my ankle, and it turned out to be non-cancerous, so I think I'm good there.
Changes in your hairs, nails, texture, anything like that?
I'm getting a few more gray hairs. I'm in my 30s, mid-30s. So.
Okay, so I know you came in with a complaint of headache, but have you had a head injury recently? Have you had any dizziness, lightheadedness, any changes of vision, anything like that?
No.
Okay, do you wear glasses, contacts?
I do not.
All right, do you have any hearing loss? Do you wear hearing aids? Any tinnitus, ringing in the ears, anything like that?
No.
Okay. Any discharge from your nose or any flaring of the nose, any stuffiness of the nose?
A little bit of congestion when I wake up in the morning. It may be related to having a cat dander. That's at least what I'm thinking it is. It's kind of like a little bit of an allergy I have, I think.
Okay. Do you see a dentist every year?
I don't actually. I need to.
Yeah, probably should. Any bleeding gums or
No.
anything like that? Okay. Any dryness in the mouth, cotton mouth, anything like that? I know you say you didn't smoke marijuana.
No.
So, okay. Any swollen lumps in your neck? Any swelling in the neck? Any lymph nodes that feel swollen or anything? Any abnormalities in your neck?
No.
Okay. Do you do a breast exam any discharge from the breast area or anything?
Not often do I test,
Mhm.
but no, I've never felt any lumps or
Okay.
anything.
Okay, no cough, no difficulty swallowing.
Mm-mm.
Okay. No trouble breathing or speaking or shortness of breath or asthma or anything like that?
No.
Okay. What about any heart problems?
No. Not that
Any
I'm aware of.
murmurs? You ever been diagnosed with any murmurs?
No.
Any palpitations? Any dizziness? Any shortness of breath?
Nope.
Do you have any trouble lying down at night and feeling like an elephant on your chest, or any shortness of breath laying down at night?
No.
Do you ever wake up in the middle of the night gasping for air?
No.
Okay.
I do
any-
snore though.
Okay. No chest pain, no palpitations?
No.
Okay. Have you ever had a stress test?
I haven't.
Okay. How's your digestion?
It's great.
Do you have any like acid reflux?
No, only like I'll get like a little bit of I take like an antacid tablet only if I've like had coffee and then I drink orange juice like in the morning, stuff like that. Or coffee, orange juice, and milk all increase your acid production, so I'll get like a little bit of heartburn after that.
Yeah.
So then, yeah, I mean I might pop an antacid tablet or something like
Okay.
that. but
What kind of
nothing chronic.
medications do you take, or do you take over the counter?
I take a multivitamin, and take PRN like Motrin or Tylenol if needed.
So nothing long.
Nothing long term or anything except for the multivitamin. Yeah.
Okay. And you're not allergic to anything?
Just the allergy to
Fish, I know.
yeah, but
Okay.
not shellfish.
Okay.
So yeah, I can do contrast and all that kind of thing. No iodine allergy.
How often do you have a bowel movement?
Anywhere from like 1 to 3 times a day.
Wow, that's actually quite a bit. What does it look like? Is it loose? Is it semi-solid? What color is it?
Usually it's formed, and I have no problems.
Is it ever yellow or look fatty or anything like that?
Not that I recall.
Okay. Do you ever notice any yellowing of the skin or the eyes?
No.
Okay.
No.
Do you ever have any leg cramps or varicose veins or any type of leg pain with exertion?
No, I do have like a couple of little varicose veins down in my heels, but I've had those for a while.
Okay.
No swelling or anything.
No swelling in the lower extremities. Okay. What about any urinary frequency?
No.
Any incontinence?
No.
What about kidney stones?
Never.
Okay. What about any hernias?
No.
Okay. Do you have any penile discharge?
No.
Do you ever had any sores on your genital area?
Mm-mm.
Okay. Do you use condoms? Are you sexually active?
Am active. I use them. Yes.
Okay. All right. Do you have any muscle pain, joint stiffness, redness or tenderness in the joints? Any chronic back pain?
No.
Okay. Any reduced range of motion?
No.
Let's see. Any depression?
No.
Any anxiety?
Only on test day.
Okay. No change in the mood, headaches, blurred vision?
No. I mean, I had the current headache, but
What about any numbness or loss of sensation or tingling?
No.
Okay. What about any discoloration of the extremities with cold weather?
It's kind of cold today. No.
Okay. All right. Any anemia or any type of easily bruising, any type of blood abnormalities that you've been diagnosed with? Any transfusion reactions?
Never had a transfusion. I don't bruise easily. I know that when I do get cut, I don't like bleed for a long time. It seems to clot pretty quickly.
Okay.
So none that I'm aware of.
All right. Do you ever have any thyroid disorders? Any cold intolerances? Any heat intolerances? Any polyuria at night? Any polyphagia? Do you ever get excessively hungry? Urinate frequently?
No.
Okay. Any changes in your shoe or glove size?
No.
You ever notice any massive weight gain?
Mm-mm.
Okay.
No.
All right. So basically, to conclude, the only medical problems you have really are you don't have many. You just have a headache every now and then. You don't really take anything you just take over the counter medications for that, like Motrin or Tylenol.
Yeah, and this headache, I have a suspicion that it was caused by. Yesterday I was spray painting,
Mm-hmm.
and I had a fan going, but I didn't have a lot of ventilation. I would say I didn't have a mask on, so it may be caused from like the fumes of that. That's the only thing recently that I can think of.
Okay.
So,
All right. Well, that concludes my health history of you. You have any questions for me?
I do not.
Okay. Thank you.